So, you sent over a really interesting bunch of stuff this week.
Yeah.
And it all seems to be about these pretty big changes happening over at HHS.
Right. The Department of Health and Human Services.
Yeah, exactly.
Big shakeup.
Huge restructuring.
Yeah.
And, layoffs across the board, it seems like.
Yeah. Tons of layoffs.
At these big federal health agencies.
Yeah, it's really something.
Yeah, and we're going to try to kind of unpack all of this today.
Yeah. Make sense of it all.
And, and try to pull out the most important things and try to really figure out what this all means.
What are the implications here?
Yeah, for all of us.
Right. Yeah, and I think what's striking right off the bat is just the sheer scale of this.
The scale of it, yeah.
We're really talking about a pretty fundamental reshaping of how the federal government approaches health in this country.
Right.
And it's essential that we look at both the stated reasons for this, these changes,
Right.
and then what the potential effects might actually be in the real world.
Okay, so let's get into that.
Yeah.
The why of it all.
The why.
From what you've shared, the big drivers seem to be this push to kind of cut down on what they're calling bureaucratic sprawl.
Mm-hmm.
Save taxpayer money.
Right. Efficiency.
And really sharpen the focus on tackling chronic diseases.
Right. Get rid of waste.
But that's kind of a broad, that's a broad stroke.
It is. It is. I mean, HHS Secretary Robert F. Kennedy Jr., he's been very, very upfront.
Right.
About, his aim is to try to create a much more efficient department.
Right.
And one that's really laser focused on what he calls the chronic disease epidemic.
Right.
And his view seems to encompass not just, medical interventions, but also addressing the environmental factors that contribute to these conditions.
Like what kinds of things are we talking about?
Well, clean food, clean water, clean air.
Okay.
And, reducing exposure to toxins that can contribute to these chronic conditions.
I see. So kind of a holistic approach?
Yeah, more holistic approach.
Looking at the bigger picture.
Absolutely.
Yeah.
And it's not just about treating the symptoms,
right,
but addressing the root causes.
I got it.
Prevention rather than just treatment.
And this isn't happening, this isn't coming out of nowhere.
No, not at all.
This is tied into a larger kind of government-wide effort, right?
Right. This is part of a bigger picture.
Yeah.
So this restructuring really aligns with President Trump's Department of Government Efficiency Workforce Optimization Initiative.
Wow, that's a mouthful.
It is. It's a mouthful.
Well, that sounds pretty serious.
It is. It's a very broad effort across all federal agencies.
I see.
To basically streamline operations and really significantly reduce the size of the federal workforce.
Shrink the government, kind of.
Exactly. Downsize, yeah.
Okay. Yeah. And the projected savings are pretty eye-catching.
They are.
If they pan out.
If they work out, yeah.
So HHS is projecting around $1.8 billion
per year
in annual cost savings.
Mm-hmm.
Wow.
That's not small change.
Yeah, that's a lot of money.
That's a substantial number.
Yeah, and I mean, that's a cornerstone of their argument for making these sometimes drastic changes.
Absolutely. I mean, that's a big selling point for them.
Sure. Okay, yeah. So how are they actually going about restructuring? What are the main organizational shifts?
Okay, so basically they're looking at significant consolidation across the board.
Interesting.
So the plan is to reduce the number of internal divisions within HHS from 28 down to 15.
Almost half.
Yeah, almost cut in half.
Wow.
And they're also cutting the number of regional offices in half.
Okay.
From 10 to 5.
Mm-hmm.
So fewer layers.
Got it.
More centralized control.
Right.
That's the thinking, at least.
More efficient.
Yeah, a more streamlined operation.
Yeah, so one of the biggest structural changes I'm seeing here is the creation of this new administration for a healthy America. Oh. AHA. Okay, what's the thinking behind merging all those different agencies?
Yeah, so what's interesting here is they really want to try to break down what they see as artificial barriers between related areas of public health.
I see.
So the AHA, it's essentially merging the Office of the Assistant Secretary for Health.
Right.
SAMHSA.
Okay.
Which deals with mental health and substance abuse services.
Okay.
HRSA, which is focused on improving healthcare access.
Okay.
ATSDR, which is concerned with the health effects of hazardous substances.
Right.
And IOSH, the National Institute for Occupational Safety and Health.
Wow. So they're putting all of that together.
All under one roof.
Under one big umbrella.
Yeah. The goal is to have better collaboration.
Sure.
A more integrated approach to overall health.
I mean, you can see the logic in that.
You can absolutely.
Trying to connect the dots.
Connect the dots.
Between mental health.
Right.
environmental health access to care.
Exactly. All of these things are interconnected.
Right.
They should be working together.
That makes sense in theory.
Yeah.
But the practicalities of merging, such diverse agencies.
It's a massive undertaking.
It's huge, yeah.
Lots of potential pitfalls.
And beyond the AHA, though, there are some other notable shifts here.
Right? There are.
Something about a focus on fraud and changes at the CDC.
Mm-hmm. Two big things.
Okay.
So first, there's a really clear push to kind of beef up enforcement against fraud within federal health programs.
I see.
So they're creating a whole new assistant secretary for enforcement.
A whole new position.
Yeah, a whole new position.
Wow.
Which, it signals a much more serious approach to this issue.
They're really cracking down.
Yeah, they're taking it seriously.
Okay.
And then second, in a move that has really significant implications for how we respond to health emergencies in this country. Okay. The CDC is going to be absorbing the Administration for Strategic Preparedness and Response.
ASPR.
Or ASPR, yeah.
Okay.
Which is the lead agency for medical and public health preparedness.
So they're kind of like
folding it into
the CDC.
Yeah, the CDC is taking over.
Okay. And the goal there is to kind of streamline the response during crises.
Exactly. Give the CDC more direct authority.
More power.
More power to act quickly.
In an emergency.
During a crisis, yeah.
Okay.
When every minute counts.
And what about research funding?
Oh, yeah. That's a really big piece of this.
Okay.
A really noteworthy part.
Yeah.
So HHS has announced the termination of over 500 research grants.
500.
Over 500.
Wow.
Totaling more than $350 million.
That's a lot of money.
That's a huge amount of research funding.
Yeah.
And these grants were reportedly focused on gender ideology and DEI research projects.
DEI.
Diversity, equity, and inclusion.
Okay, so they're cutting funding.
Cutting research in those areas.
To these very specific areas.
Yeah, very specific. And this has definitely caused a lot of controversy, though the sources we have don't really give us a very detailed breakdown of the specific research that's being cut.
Right.
Or, what the broader consequences of these cancellations might be.
Right. So we've talked about the why.
The why.
Behind the restructuring.
The stated goals.
The stated goals, the organizational changes. But let's talk about the what.
The what?
Because a lot of the news has been about the what. The sheer scale of these layoffs.
The layoffs.
It seems like a lot of people are being affected.
A lot of people, a lot of jobs. Yeah. I mean, the numbers are pretty stark.
Yeah. What are we talking?
So overall, the plan is to reduce the HHS workforce from 82,000 to 62,000 full-time employees.
So it's
a reduction of 20,000.
A big cut.
A huge cut.
Wow.
And that includes a direct layoff of 10,000 individuals.
10,000 people.
10,000 people losing their jobs.
Just like that.
Just like that.
Wow.
And then on top of that, they're expecting 10,000 positions to be vacated through voluntary departures.
So people leaving.
People retiring or quitting.
Okay.
And then there were also roughly 5,200 probationary worker terminations.
Probationary?
Yeah, newer employees.
Okay.
Who hadn't yet been made permanent.
I see.
And those happened just before April 1st.
Right before the big day.
Or before the layoffs hit.
Wow. So a significant reduction.
Yeah, a huge contraction across the board.
Across the board, yeah.
Yeah.
And we have specific numbers for some of the major agencies.
Right.
Which really kind of
underscores how widespread these cuts are.
Yeah, it really shows you how big this is.
Yeah, every corner of HHS is being affected.
So the FDA.
Yeah, the Food and Drug Administration.
They're looking at a reduction of 3,500 full-time employees.
3,500 people.
The CDC.
The Centers for Disease Control and Prevention.
Facing 2,400 fewer positions.
2,400 jobs gone.
And the NIH.
The National Institutes of Health.
Seeing 1,200 job cuts.
A big hit to research. And they're blaming that partly on centralizing some procurement and administrative functions.
Okay, so they're trying to streamline.
Streamline operations, make things more efficient.
Okay.
And even CMS, which manages Medicare and Medicaid.
Huge programs.
Huge programs, yeah.
Even they're seeing a reduction.
They're not immune.
Of 300 full-time employees.
300 fewer people.
Wow.
To manage those massive programs.
So the way these layoffs unfolded on April 1st.
Yeah, the big day.
It really paints a picture of a pretty disruptive and unsettling day.
It was chaotic.
For a lot of people.
A lot of people were caught off guard.
Yeah.
It wasn't just numbers on paper.
Right.
It was real people's lives.
Yeah, real people with families and mortgages.
Exactly. Livelihoods disrupted.
So the reports that we're looking at,
yeah,
they describe a pretty chaotic scene.
Yeah.
A lot of employees received early morning emails.
The dreaded email.
Yeah, informing them that their jobs were gone.
Out of the blue.
Yeah.
First thing in the morning.
And there were accounts of security badges being deactivated.
Yeah, locked out.
Yeah.
Can't even get into the building.
Preventing people from even entering their workplaces.
Yeah, their jobs just vanished overnight.
And the Associated Press,
yeah,
they reported seeing hundreds of federal health employees
just standing around.
Yeah, lined up outside the HHS building in D.C.
In shock.
Yeah.
Trying to figure out what was going on.
Just trying to get information about their employment status.
Yeah. What does this mean for me?
Yeah, what do I do now?
What about my health insurance?
Yeah.
It must have been incredibly jarring.
Yeah, absolutely. And it wasn't just, general staff reductions.
Yeah.
We're hearing about entire offices being eliminated.
Whole offices gone.
Which has to raise some serious questions about the future of that work.
Absolutely. What happens to those programs now?
So what's particularly concerning is the reported elimination of the entire Office of Equal Opportunity and Civil Rights.
At CMS?
At CMS, yeah.
Yeah, that's a big one.
And the way it was handled is kind of disturbing.
Yeah, really troubling.
Layoff notices apparently referencing a deceased former director.
A deceased director.
Yeah, that just suggests a real lack of attention to detail.
Yeah, and sensitivity.
And potentially a very insensitive approach.
Yeah, it's really not a good look.
And similarly, reports indicate that nearly the entire Office of Minority Health
at CMS,
that's CMS, was cut.
Gone.
And their website went offline.
Just disappeared.
Yeah. That raises real concerns about the commitment to addressing health disparity.
Yeah, what are their priorities?
Yeah.
If they're gutting these offices.
Okay. Another area that's raising red flags is the reported termination of the entire staff of the Low-Income Home Energy Assistance Program. LIHEAP. Yeah, that's a lifeline for a lot of vulnerable families.
It is. It helps so many people keep their homes warm in the winter, cool in the summer.
Exactly.
And now the whole staff is gone.
Gone.
How's the program supposed to function?
Yeah, it raises serious questions about how the remaining funds will be distributed.
Right.
And whether the program can continue to function effectively.
Will anyone get the help they need?
Yeah, and experts in energy assistance are sounding the alarm.
Yeah, they're very worried.
About the potential impact on millions of people.
Millions of people could be left out in the cold.
Literally.
Yeah,
and it wasn't just administrative roles that were cut.
No.
We also saw reports of senior scientific and public health expertise being let go.
Yeah, losing valuable expertise.
Including people involved in critical areas like responding to the bird flu outbreak.
Like Tristan Colonius, the FDA's chief veterinary officer, who was really instrumental in the agency's response to the bird flu situation.
Yeah, he was a key player.
He was on the front lines, and he's gone.
Gone.
Along with several other senior veterinarians.
So they're losing all this experience.
Years of experience gone.
Yeah, and that could definitely have implications for our ability to respond to animal and zoonotic disease threats.
Absolutely. We're less prepared now.
And on top of all of that, to add to the uncertainty and the distress,
the chaos,
there were reports of potential problems with the layoff notices themselves.
Yeah, adding insult to injury.
Yeah.
So some FDA employees, they got layoff notices, but the notices had inaccurate performance ratings.
Inaccurate?
Yeah, lower than their official records showed.
So they were being penalized.
Yeah, and that directly affects their severance pay.
So they're getting less money.
Less money than they deserve.
Wow.
It just creates more confusion and anxiety for people who have just lost their jobs.
Yeah, it's like they can't even get it right.
It's a mess.
Yeah, it suggests a potentially chaotic and error-prone process.
Yeah, it doesn't inspire confidence.
Okay, so we've looked at the why.
The what.
We've looked at the what.
The what.
Now comes the crucial part.
The so what.
What are the potential consequences of all of these changes?
The big question.
And what are the experts saying?
Right.
Because it sounds like there's a lot of concern.
There is a lot of concern.
Coming from former officials.
Yeah, people who know this system inside and out.
Right, people who've been there.
Yeah.
So Dr. Robert F.
Former FDA commissioner.
Right.
He didn't hold back.
He did not mince words.
He said publicly that the FDA, as we've known it, is finished.
Wow.
Because of the loss of experienced leaders.
So he's saying it's over.
It's a different agency now.
The FDA is done.
Yeah, he's very worried about the potential impact
Yeah.
on the agency's ability to oversee product development
Right.
and ensure safety.
So basically he's saying that the things that the FDA is supposed to do,
Yeah.
they might not be able to do them anymore.
He might not be able to do them effectively.
That's a pretty stark warning.
It is. It's a major red flag.
Yeah.
Coming from someone who knows the FDA so well.
And Dr. Mandy Cohen?
Yeah, the former CDC director.
She's also voiced strong concerns.
Yeah, she's worried too.
From a public health preparedness standpoint.
Exactly.
What's she saying?
She's warning that these cuts leave the country less safe, less prepared.
Less safe to deal with future health threats.
Any kind of health threat,
right.
Whether it's a pandemic
right.
or an emerging infectious disease.
Bioterrorism.
Natural disasters. Anything.
Anything you can think of.
Yeah, and she's saying that losing experienced scientists and public health professionals.
Yeah, the people on the ground.
It inevitably weakens our ability to detect, prevent, and respond to these challenges.
We're losing our capacity to protect ourselves.
Right.
And the potential impact on specific programs
right.
is also a major worry.
Like we were talking about with LIHEAP.
Right. That's a perfect example.
Mark Wolf
from
the National Energy Assistance Directors Association.
He's in the front lines of this.
And he's very concerned about the program's future.
Yeah, without its dedicated staff.
I mean, a program like LIHEAP.
Yeah.
It relies so heavily on experienced staff.
Right.
To manage all the complexities of funding distribution.
Right.
And make sure that the aid actually reaches the people who need it most.
The people who are struggling.
The people who are struggling to pay their energy bills.
Yeah, and eliminating the entire staff creates a massive operational hurdle.
Yeah, it's a recipe for disaster.
Yeah, and then the elimination of the CMS Office of Equal Opportunity and Civil Rights.
Yeah.
That's drawn a sharp reaction from Karen Shields.
Yeah.
A former CMS executive.
She knows what she's talking about.
She does.
And she's not happy.
Yeah, what's she saying?
Well, first of all, she highlighted the troubling decision to eliminate this office,
right?
Which is so important for ensuring fairness and equity in healthcare access.
Right, for making sure everyone has a fair shot.
Exactly.
At getting the healthcare they need.
Regardless of their background. And then she also pointed out the incredibly flawed layoff notices.
Yeah, those notices.
The ones that referenced a deceased former director.
It's just unbelievable.
It's a real slap in the face.
Yeah, and she's saying that this suggests a real lack of care and coordination.
Yeah, they're not paying attention.
During this whole process.
They're just rushing through it.
And Chiquita Brooks-LaSure.
Another former CMS administrator.
Right.
She also emphasized the critical role of the Office of Minority Health.
Yeah.
Which has now been significantly reduced.
Right, so they haven't eliminated it entirely.
No, but they've cut it way back.
But they've really cut it back.
Yeah.
And Brooks-LaSure is saying that this office is vital.
Absolutely essential.
For addressing the persistent and unacceptable health disparities.
Right. The gaps in health outcomes.
That exist across different racial and ethnic groups.
Yeah, we know that certain groups face much worse health outcomes.
Right.
And this office is supposed to be working to close those gaps.
And now they have fewer resources.
Fewer resources, less staff.
So it raises serious questions about the commitment to health equity.
Yeah. Are they really serious about addressing these disparities?
Yeah, we're also getting a sense of the atmosphere within these agencies.
Yeah.
As these layoffs unfolded.
The mood on the ground.
It sounds incredibly disruptive and demoralizing.
Yeah, toxic.
Toxic, yeah.
One FDA employee used the term bloodbath to describe the situation.
Wow.
Which, I mean, that's a really powerful and disturbing image.
It is.
And it conveys the sense of shock.
Right.
The loss.
People's careers.
Yeah.
Just gone.
Just gone.
And deep uncertainty that these people are feeling.
Their whole lives have been turned upside down.
Yeah, I mean, these are individuals who've dedicated their careers to public service.
Yeah, they wanted to make a difference.
And now they're facing sudden job loss.
Yeah.
And an uncertain future.
What are they going to do now?
Yeah. And despite the stated focus on chronic disease.
Yeah.
It seems like the cuts at the CDC have been pretty broad.
They have been.
Impacting a lot of fundamental public health functions.
Way beyond just chronic illness.
Yeah. So give us some examples.
Sure. So the cuts at the CDC are hitting divisions that work on things like workplace health and safety.
Okay.
HIV prevention,
right.
Injury prevention, reproductive health, smoking cessation,
right.
and violence prevention.
So these are all core public health functions.
They are the bread and butter of public health.
That contribute significantly to overall health and well-being.
Absolutely.
And cutting back in these areas could have wide-ranging consequences.
Yeah, we could see a real decline in public health.
And it's worth remembering that these events are happening within a broader political and economic landscape.
Right, we can't ignore the context.
And Senator Cory Booker, he gave a very long speech.
A marathon speech.
A marathon speech in opposition to the Trump administration.
Yeah, he's a vocal critic.
And that provides some of that political context.
Right, it shows the deep partisan divide on these issues.
So how long was his speech?
I think it was close to 20 hours.
20 hours?
Yeah, he just kept talking.
Wow, so he really laid out his opposition.
He did. He held nothing back.
To these policies.
To the Trump administration's agenda.
And the planned implementation of significant tariffs is also creating a backdrop of economic uncertainty.
Yeah, things are really shaky right now.
Which has to be amplifying the anxieties of those who've lost their jobs.
It's a double whammy.
Yeah, it's a tough time to be looking for a new job.
Yeah, the job market is not looking good.
So to kind of bring it all together, this deep dive has shown us a really massive restructuring underway at HHS.
A huge overhaul.
Driven by these stated goals of efficiency, cost savings, and a greater focus on chronic disease.
Those are the talking points.
But this has been accompanied by very significant layoffs.
Thousands of jobs lost.
And serious concerns being raised by former officials.
People who know what they're talking about.
And current employees.
The people on the ground.
About the loss of critical expertise.
Yeah, we're losing valuable knowledge and experience.
And the potential for real negative impacts.
Yeah. This could have serious consequences.
On our public health infrastructure and vulnerable populations.
The people who rely on these programs the most.
So while the administration is presenting this as a necessary step towards a more efficient and effective health system.
A leaner, meaner HHS.
Right.
That's the spin.
The reported consequences paint a much more complex and potentially troubling picture.
Yeah, there's a lot more to this story.
Particularly when we consider, the nation's ability to protect public health.
Right.
And provide essential services.
Are we going to be less safe?
Yeah, that's the big question.
That's what we need to be asking.
You came to us wanting to understand this really complex situation.
Yeah.
Without getting lost in the details.
It's a lot to take in.
It is.
Yeah.
And hopefully this deep dive has given you a clear and comprehensive overview.
Yeah, we've tried to hit the high points.
Of what's happening at HHS.
And explain why it matters.
And why it matters to all of us.
To everyone.
Yeah. So here's a final thought.
Okay.
For you to really chew on.
All right.
Considering the sheer scale of these changes at HHS.
It's huge.
And the very different perspectives that we've discussed today.
And the supporters and the critics.
What do you think are the most critical areas
to
keep a close eye on in the coming months and years?
Where should we be focusing our attention?
In terms of their actual impact on public health and the lives of everyday Americans.
Right. What are the real-world consequences?
Yeah, and what specific questions are still lingering for you after this discussion?
Yeah, where do we go from here?
It's vital to stay informed.
Absolutely.
And critically evaluate how these changes unfold.
Don't just take their word for it.
Yeah.
Look at the evidence.
So how will our preparedness for future public health emergencies be affected?
That's a big one.
What will be the long-term consequences for health research and innovation?
Will we still be a leader in these areas?
And how will vulnerable populations be impacted?
The people who need help the most.
By the cuts to specific programs and offices.
These are the questions we need to be asking.
Yeah, these are crucial questions to continue asking.
And demanding answers.
And we encourage you to keep exploring this important story.
Stay engaged.
Yeah.
Stay informed.
And form your own informed opinions.
Don't be passive.
Thanks for taking this deep dive with us.
It's been a pleasure.
Yeah, we'll see you next time.
See you later.
Bye.